Hemoglobin A is composed of three forms, Hb A1, Hb A1b, and Hb A1c, which are referred to as glycated or glycosylated hemoglobin. Hb A1c is the main form. Glycated hemoglobin is formed from the non-enzymatic, irreversible attachment of glucose to hemoglobin A1. Measurement of glycated hemoglobin reflects blood glucose levels for the past 2 to 3 months. It is useful in monitoring effectiveness of treatment and compliance of diabetic individual to treatment protocol. Measured by affinity chromatography, ion exchange chromatography, and high-performance liquid chromatography. Specimen collection. Non-fasting blood drawn in EDTA tubes. Reference range 4 to 6% Hb A1c. Effective treatment range 7% Hb A1c. Fructosamine, ketoamine linkage forms between glucose and protein, mainly represented by albumin. Clinical significance. Measurement of fructosamine reflects blood glucose levels for 2 to 3 weeks before sampling, measured by spectrophotometric colorimetric methods, affinity chromatography, and high-performance liquid chromatography. Reference range 205 to 85 mol/L. Measurement of albumin excretion is useful for patients with renal complications of diabetes mellitus. Performed on random urines, microalbumin analysis always requires the simultaneous analysis of creatinine, and it is reported as an albumin-creatinine ratio. Abnormal values, microalbuminuria, will be 30 mg albumin-a-d creatinine. Measurement of plasma glucose, glucose oxidase method, BD glucose plus H2O plus O2, gluconic acid plus H2O2, H2O2 reduced chromogen, oxidized chromogen, colored H2O, hexokinase method, glucose plus ATP, glucose 6-phosphate plus ADP, glucose 6-phosphate plus NADP, 6-phosphogluconate plus NADPH plus H+. Clinical significance. An increase in the blood glucose level is the hallmark of diabetes mellitus, but it can also be indicative of other hormonal disorders such as Cushing disease. Reference range, adult fasting 74-99 mg per deciliters. Lactate. The normal end product of glucose metabolism is pyruvate. However, lactate is produced under conditions of oxygen deficit, anaerobic metabolism. The production and accumulation of lactate in the blood and its measurement aid in assessing the degree of oxygen deprivation that is occurring. Change in the blood lactate level precedes a change in blood pH. Lactate is metabolized by the liver via gluconeogenesis. Test methodology. Lactate plus O2, pyruvate plus H2O2, H2O2 plus reduced chromogen, oxidized chromogen, colored, plus H2O. Clinical significance. Type A lactic acidosis is caused by depressed oxygen levels that may occur in acute myocardial infarction, congestive heart failure, shock, pulmonary edema, and so on. Type B lactic acidosis is caused by metabolic processes that may occur in diabetes mellitus, renal disorders, liver disease, ingestion of toxins, salicylate overdose and excess ethanol, and so on. Special specimen handling is required and includes the following. Avoid using a tourniquet because venous stasis will falsely raise blood lactate levels. Place the specimen on ice and immediately transport to the laboratory. Centrifuge the specimen and remove the plasma, additives NAF and K2C2O4 as soon as possible. Reference range venous 0.5 to 1.3 mmol/Becker. Lipids and lipoproteins, lipid structure. Fatty acids exist as short, medium, and long chains of molecules that are major constituents of triglycerides and phospholipids. Minimal amounts of fatty acids are bound to albumin and circulate free, unesterified in plasma. Triglyceride. Triglyceride is formed from one glycerol molecule with 3 fatty acid molecules attached via ester bonds. Triglycerides comprise 95% of all fat stored in adipose tissue. Triglycerides are transported through the body by chylomicrons and VLDL, very low-density lipoprotein. Metabolism involves releasing the fatty acids to the cells for energy, then recycling the glycerol into triglyceride. Lipase, lipoprotein lipase, epinephrine, and cortisol break down triglycerides. Cholesterol, unsaturated steroid alcohol, exists in the esterified form, where a fatty acid forms an ester bond at carbon 3 and the free unesterified form. Precursor for synthesis of bile acids, steroid hormones, and vitamin D. Low-density lipoprotein, LDL, is the primary carrier of cholesterol. Phospholipid. Composed of one glycerol molecule and 2 fatty acid molecules attached via ester bonds, found on the surface of lipid layers, they are major constituents of cell membranes and outer shells of lipoprotein molecules. Classification of lipoproteins. Lipoproteins are molecules that combine water-insoluble dietary lipids and water-soluble proteins, apolipoproteins, so that lipids can be transported throughout the body. Micelles are spherical and have an inner core of neutral fat. Chylomicrons are the largest lipoproteins and have the lowest density. They are formed in the intestines and transport triglycerides after a meal, giving serum a turbid appearance. Because of their low density, chylomicrons will float to the top and form a creamy layer when plasma is stored overnight. Chylomicrons are composed of 86% triglyceride, 5% cholesterol, 7% phospholipid, and 2% apolipoprotein. Chylomicrons have apoproteins B48, mainly, and lesser amounts of A1, Ci, C2, and C3 on their surface. In normal lipid metabolism, chylomicrons enter the circulation and are metabolized to remnant particles for uptake and further modification by the liver. Very low-density lipoprotein carries endogenous triglycerides synthesized in the liver. VLDL molecules are composed of 55% triglycerides, 19% cholesterol, 18% phospholipid, 8% apolipoprotein, and have apolipoproteins B100 mainly in C1, C3, and E on their surface. In normal lipid metabolism, VLDLs are secreted into the blood by the liver for metabolism in peripheral tissues. Intermediate density lipoprotein, IDL, is a transitional form as it is formed from VLDL and then further modified in the liver to LDL. IDLs carry endogenous triglycerides and cholesterol esters. IDL molecules are composed of 23% triglycerides, 38% cholesterol, 19% phospholipid, 19% apolipoprotein, and have apolipoproteins B100 mainly, and some E on their surface. Low-density lipoprotein is the body's major cholesterol carrier and transports a large amount of endogenous cholesterol. Known as bad cholesterol, LDL is easily taken up by cells, so elevated levels are associated with increased risk for atherosclerosis. LDLs are composed of 50% cholesterol, 22% phospholipids, 6% triglycerides, and 22% protein, and have apoprotein B100 on their surface. In normal lipid metabolism, this lipoprotein brings cholesterol to peripheral cells for membrane synthesis and formation of adrenal and reproductive hormones. High-density lipoprotein, HDL, is also known as good cholesterol. HDL is synthesized in the intestine and liver cells. HDL molecules are recycled chylomicron and VLDL molecules. HDL is composed of 50% protein, 28% phospholipids, 19% cholesterol, and 3% triglycerides. HDL has apoproteins AI mainly and A2 on its surface. In normal lipid metabolism, HDL removes excess cholesterol from peripheral tissues and transports it to other catabolic sites. This function has an anti-atherogenic